then I'll first talk about finding biobanks and samples, so the perspective of a researcher, and then afterwards about getting listed, so how as a biobank you can get listed in these tools, and at the end there will be time for questions and answers. And yeah, so the use case for these tools is what we see is that the usage of samples in biobanks is generally low, so 10 to 15% usage is something that I've heard from several biobanks. Researchers often collect new samples instead of using samples that are already collected in a biobank, which means that it takes quite a lot of time for them to really get started with their experiments, because it takes time to recruit patients and get their samples. And patients, especially rare disease patients, are really vocal about that they expect their samples that they donated to actually be used in research for their disease. And by improving the discoverability of existing samples, we can increase usage and speed up research, because researchers don't have to spend as much time in recruiting patients and collecting samples. So as I mentioned, there are several tools that have been developed for this. The BBMRI-ERIC Directory is a tool that lists biobanks and their collections. So this is lists the organizational details and aggregated information about groups of samples. I hear someone's noise, please mute. And so this is aggregated samples or collections, so numbers of samples aggregated by type, disease, types of data, etc. And networks in which a biobank is active. So the concept of networks is maybe not always clear, but in rare disease, as some of you might know about the Biobank, which is a network of several biobanks for rare diseases that collaborate. But other good example is TNGB, the Teleton network of genetic biobanks in Italy, or also a national node in BBMRI-ERIC can be seen as a network of biobanks. And so the directory is available at directory.bbmri-eric.eu, and sign up is either through the BBMRI national nodes or BBMRI-ERIC headquarters if not part of a national node. And there's an email address for that. More details about signing up later. The BBMRI-ERIC directory has a federated design. With this, I mean that the data of the content of the directory does not comes from the different national nodes mainly. So national nodes might have their own directory and contribute data to the BBMRI-ERIC Directory, and the national nodes are responsible for managing the sample data and the biobank data. Then the other tool is the ID Connect Sample Catalogue, which lists individual samples and has some limited demographic information and information about the sample, like an anatomical site where it was taken, the type of material, the disease with which the patient was diagnosed, and hosting biobank, and some information if there is information available in a biobank or registry about other family members, related samples, etc. And sign up for this goes through the support team at the UMCG. And if we try to compare these two tools, then you see that the ID Connect Sample Catalogue is really about individual samples. Currently, about 70,000 samples listed, mostly from biobanks that are part of your biobank. It is focused on rare diseases only, but it has worldwide coverage. The BBMRI-ERIC Directory instead lists collections of samples. There are about 2,400 collections listed in the biobank, in the directory, from about 650 different biobanks, and together these represent millions of samples. It's not only about samples, but a biobank can also advertise services in the directory, and this is not only about rare diseases, but also common diseases, but also includes collections that are about population, so healthy subjects, and the coverage of the directory is mostly the BBMRI national nodes, but for rare disease and COVID-19, there is an exception that also biobanks outside of a BBMRI national node are accepted to be listed in the directory. Both tools have been are linked to the BBMRI-ERIC Negotiator. So the Negotiator, which you can also access directly at negotiator.bbmri-eric.eu, is a tool that facilitates the communication between a biobank and a researcher in the context of a request for samples. It allows one-on-one and multi-party discussion through a chat functionality in the website, and it provides the biobank and the researchers with an overview of the requests and the status of the request with each biobank. Researchers log in to the website through the Life Science AI system, or at this moment still the BBMRI-ERIC AI system, but this is merging into the Life Science AI. So they log in with the institutional account if institute is part of the Life Science AI, or if it's not, they can sign up in the hostel and then log in. All the services that are part of Life Science AI with their self-registered account. Biobanks can have to get listed first in one of the discovery tools and will then be invited to register in the negotiator. And so the process of finding biobanks, requesting samples, is that you start out with one of the discovery tools, so the ID Connect Sample Catalogue or the BBMRI-ERIC Directory, to search for relevant samples. So you can do this, for instance, at the basis of disease or type of material. Once you have identified useful collections, then you can file a request using the negotiator, and in the negotiator have the discussion with the biobanks to refine your request. So these discovery tools don't list all the details of a sample, so there are always things that you would have to ask later on. For instance, specific methods of conservation or protocols of collecting the samples might not be available in the discovery tools, or also things about a specific associated data that you would need. And once the biobank indicates that they can provide you with samples or data, then you can have a one-on-one discussion with the biobanks to come to an agreement on the exact conditions of use for the samples. So this is about cost recovery, data and material transfer agreements, things like that, that are more privileged communication, while additional details about what you exactly need can be a multi-party discussion. So go to all the biobanks that you identified. So some tips if you use it. As I mentioned before, the discovery tools don't have all the detailed information, so you use them to narrow down the list of biobanks to the best candidates. And biobanks can also list additional services they can provide in the directory. So if you require more assistance than just acquiring some samples and data, that is something that's useful to have a look at. And then use the negotiator to ask all the details that are not available in the discovery tools. And now I would like to go to a short demo. So I hope this will work, and I hope you would now see my browser. Can someone confirm this?
Yes, Esther, we're able to see it shows the RD Connect, says welcome to the RD Connect Sample Catalog.
Great. So this is the first tool I want to quickly show. So if I click on Sample Catalog, I go to the main screen where I can search. So on the left-hand side, I can see the different fields that I can search on. And for this demonstration, I'll start with searching for Duchenne. Now I see here Duchenne and Becker muscular dystrophy, Duchenne muscular dystrophy, symptomatic form of muscular dystrophy of Duchenne and Becker female carriers. In my demo, I'll select all of them and then click on Apply. And now I see here the number of samples for each of these different forms. If I don't want to see this split down in, I can here select, for instance, that I want to see the numbers per hosting biobank, and I can also refine here that I only want to search to have plasma, and then I want to split it up by disease, and then I see that this biobank is the only one that has plasma for Duchenne muscular dystrophy. So this is one way of searching. So this is really based on information about individual samples that was provided by the biobanks. Then I now go to the BBMRI-ERIC Directory, where we can search on collections. So as I've mentioned before, BBMRI-ERIC Directory also has samples for common diseases or healthy participants, so I can filter out first of all for rare disease collections, and then I can see that there are a number of biobanks that have marked that they have rare disease related samples. I can then also select, for instance, on that I'm interested in DNA. I could also search here on a diagnosis. So both OrphanNet and ICD codes are being used in the BBMRI-ERIC directory, but most biobanks use only use the ICD code, so that is something to be aware of. We're still looking at some tools to do automatic matching in the backend between the OrphanNet codes and the ICD code, so you can search on either of them. I can now say, okay, I'm interested in specifically this collection and have a look at this. By clicking here, then I see some more details, also the contact person, but instead of directly contacting person, I add this collection now to my selection. I go back. Now you see here that I have one collection selected. I can also select more. I can do that directly at the biobank, or I can click on the card and select it based on the details. So I now have two selected, and I can now click here to show the selection. I see a quick overview again of my selection, and I can here say, okay, I want to send this to the negotiator. This is going to the live version of the negotiator, so here I would have to log in, but I'm not going to do a real request now because I don't want to pollute the data for these two biobanks with a bogus request. But we also have a demo version of the negotiator where I want to show you a little bit. So in this case, I select I'm a researcher. This is the demo version. So if I have a request, then I will fill in some details, and then I get my request. So in the request, I provide some information about the project, the request itself. So it gives some of the details of the researcher. And here you have some of the status. So also the chat and one-on-one chat. And I'll go a bit more into details for the negotiator in the second part. Now going back to the presentation. So you now have seen how a researcher can search and file a request. So if you're a biobank and you have to handle a request in the negotiator, you have the group chat and one-on-one chat that you can use to communicate with the requester. So if it's going through the group chat, then all the biobanks that were included in the request will receive the messages. So this is useful for asking more details for a request that might be relevant for other biobanks as well to know. So you can effectively help the other biobanks also, because you all get the same information and you can see, okay, someone has already asked for this additional information about the research or the specific methods, and can have a discussion about if a specific type of sample is actually suitable for the type of research that researcher wants to do. And then the one-on-one is for the more privileged communication, like negotiations on the terms, the signing of MTA, DTA. If you can't provide requested material, you can always say, okay, I'm out, and step away from the communication, and then the negotiator will not notify you about this request anymore, and the requester will also see that you stepped away. So then I'll try to do the show it in the live version again. But if you later on want to look at the slides, there's also a small movie here that shows something about the negotiation process. So I'm now going back, and in this demo development version, I can pick that I'm a biobank owner, then see again, I can see the requests from the different users. I can see here information about the status of a request, and I can archive a query if I'm not interested and step away from it by ignoring it. I can also go into the details again. So then here you can see this biobank user is representing several biobanks, and for each of the biobanks you can update your status for a request. So you can have the request write chat. So this is the chat with multi-party chat. So here I can ask some question, detail a bit more about the type of analysis. For instance, then I can comment. So this is something all biobanks and the requester will see. So all the biobanks that are involved in this request, and also have the one-on-one communication, where you basically you can do the same, and you can also upload files, and for instance, could use this to upload MTA or DTA. Not going to do that right now. And so here again you see the tests. And I'm going back. I can also say, okay, I'm done with this request. So I archive this. And so this is a way by how you can have an overview of requests that go that you receive, and ask questions and see the information from the researcher. And once if you can't participate anymore, you can ignore and archive them. And then back to the slides. I still want to talk a bit about how you can get listed. So getting listed in the first of all in the directory, there are different criteria of eligibility for getting listed in the directory. Either you are part of a BBMRI national node, and for national nodes, the criteria for being listed can vary. That is something they decide themselves. Or you can get listed if you represent a rare disease focused biobank or a COVID-19 biobank. For these two cases, there's no need to be part of a national node. And then the steps to get listed, if you want to, if you're part of a BBMRI national node, you should contact your national node for support. And if you're out rare disease or COVID-19 biobank outside of a BBMRI national node, you should contact a BBMRI-ERIC headquarters. at the directory at helpdesk.bbmri-eric.eu email address. This will you will get back a reply from a ticketing system, and from there this is assigned to someone from the data managers at UMCG who will support you. Then to get in there, you together with your national node or with support data managers operating through support team at UMCG, you will have to prepare the data that describes your biobank organization and the collections of samples. So you will have to think about how to represent your samples in the directory. Do you want to split them up in collections per disease, or are they collected as part of different research projects? Is that a logical way of representing them? This is something you have to discuss and see what fits best for your samples and your biobank. And we have a manual that describes the data that you need to prepare, and that is always available as download from the BBMRI-ERIC website. So the link is also in this presentation, but I'll also quickly show you. So if I go back to the directory, you here have a tab for manuals, and if I select that, and then the second option here is the download link for the data manager's manual. And after you get listed in the directory, you will get at some point, that might take a couple of weeks, also get an invitation from BBMRI HQ to get listed in the BBMRI-ERIC Negotiator. And we use the contact email address that you listed in the directory for this invitation, but you can assign different users as contacts in the negotiator to handle requests and questions from researchers. And you can do this for the whole biobank, or different contacts for specific collections. For the ID Connect sample catalog, the process is a little bit differently. The main requirements are that you are a rare disease focused biobank, and that you can provide sample level data. Because we show counts, actual counts in the sample catalog, we really need to have the sample level data. So for the Fondazione Telethon associated biobanks TNGB, there is a link in the TNGB website that you can use to publish samples in the sample catalog. For others, the process is as followed. So in early 2020, we are going to do a coordinated action for biobanks that are part of an ERN. And we will do that together with the ERICA project that is there to as a overall project for supporting ERNs. If you're not part of one of the ERNs, you can contact us at Multigender Support at UMCG .nl email address, and then we can help you getting your sample in. But we also want you to register in the BBMRI-ERIC Directory because the sample catalog is at a higher, is at a level of individual samples. We don't have all the contact information about biobank in there, and that's something we need you to provide in the BBMRI-ERIC Directory. And then together with the support team, prepare the data that describes the individual samples that you have. So this is mainly about encoding the data with the right ontology code. We will provide you with manuals. So currently the manuals are under revision. From the earlier experiences, we learned a lot. They were way too complicated, so try to make them a bit easier to understand. And yeah, those I don't have a link for them right now, but once they are ready, we will publish them also online. And after you get listed again, you will get the invitation for the negotiator, and you can assign different users as contact for the negotiator to handle different requests.